watching the award-winning GHS-TV, a nationally recognized student television station.
Hello, thanks for watching Medical Talk. I'm your host, Betty Lamar. My guest today is Samuel G. Putnam III, MD, interventional radiologist with Morton Vascular of Memphis. My conversation today is all about your vascular health. Well, thank you, Dr. Putnam, for joining me today on Medical Talk.
You're welcome. Great to be here. Thanks for having me. Sorry I couldn't be there in person, but here we are remotely.
Well, that's right. Well, you know, that's how we've been doing it, you know, during this COVID pandemic, but I'm just so happy. And speaking of that, where are you this morning?
Actually at Modern Vascular in Denver. We have labs all over the country and covering Memphis, and right now I'll be moving back to Memphis permanently in a few months, and I'll only be in Memphis come July, August timeframe. Right now I'm just back and forth.
Okay, well, speaking of Morton Vascular of Memphis, I attended a grand opening recently of your new facility, and it was just awesome, wonderful, very well done. Tell us exactly who you are to get this started as it relates to Morton Vascular of Memphis.
So I am an interventional radiologist, and thank you for coming to that opening. Yeah, that was a great time. I think it was really well done. It was a long time coming. Thankfully, after about a year of planning and then a year of just putting it together, it's been a couple of years. So I joined Modern Vascular about a year ago now with the plan of covering the Memphis facility. And it just opened. So in the meantime, I've been covering other facilities around the country. So my history, my background is as an interventional radiologist. We are trained in minimally invasive procedures, doing all sorts of things for various disease entities. A big part of our repertoire is peripheral artery disease, which is our focus at Modern Vascular, although we're doing other things as well. So I've been hospital-based really for the last 25 years, and this opportunity came up with Modern Vascular, which is a growing company building labs around the country. We're up to 17 now with an 18th lab about to open. So I'm real happy to be in this type of environment. I really like being in the outpatient world. After all the years of being in the hospital, it's a really nice change. I think it's great for patients. It's great for staff. It's just a whole different, nice way to treat people. So I'm liking it.
Okay, now, of course, I had to do a little research, right? So it would appear as though I know what I'm talking about. I tell people, Dr. Putnam, that I did not get into medical talk because I'm a doctor. I chose this topic of conversation because I feel like people need to know about their health and wellness, and I always say plain and simple, right? So I do the plain and simple, and I let the doctors, give us the information that we need. But in my research, your name and the military was mentioned, right? So I'm a veteran, so naturally that piqued my interest. So what is your connection with the military, if any?
So in med school, I was lucky to obtain a scholarship from the Army. So they essentially paid my tuition through medical school, and I had to pay them back. So I did 4 years active duty after my medical school and internship training. I was stationed in Korea and Germany and Desert Storm for 6 months. So that was my active duty experience, and that's how I became a veteran. It was a great deal for me. I'm really happy for the experience and the privilege of serving the country for those few years, and actually had a really good time overseas. So I was happy with that experience.
Okay, now wonderful. We're going to jump right in. And I have a loaded question for you, okay? So what is PAD? How is it diagnosed? And what is the, I guess, overall complications associated with PAD?
So PAD stands for peripheral arterial disease, and it's just that. It's plaque buildup in the arteries throughout the body. It's really the same disease and the same process that causes heart attacks and strokes, but we don't call those PAD. That's more carotid artery disease with the strokes and coronary artery disease with the heart attacks. But the cause and the risk factors and everything that leads to it is the same. And it's essentially plaque buildup in the arteries. Some people are just prone to it. There's certain disease entities that make you more prone to it, like diabetes and high blood pressure and high cholesterol. Smoking is a big one as far as modifiable risk factors, obesity, sedentary lifestyle. So there's things that can be avoided to make you less prone to have it, and actually controlling your diseases can make you less prone. It manifests in the peripheral realm, what we treat, more down the legs than anything else. You can also get it in arms or anywhere else in the body, but mostly down the legs. And people over time, as you get older, who do get it will start to experience some symptoms, usually pain when they're walking to start, maybe limited walking, calf pain, pain in the buttocks, or pain in the feet. As it progresses, you can develop rest pain in the feet or anywhere down the legs. As it gets worse, then you start to get severe blockages, limiting circulation to the toes and the feet. You can develop ulcers. Worst case scenario, the ulcers then lead to gangrene and then eventually lead to amputations. So obviously we want to halt that whole process and do what we can as far as identifying early on, treating early on by modifying the risk factors, treating the underlying diseases, and if we need to do procedures to increase flow down the legs, that's what we do at Modern Vascular.
Okay, well, we're going to take this segment out, and when we come back, Dr. Putnam, I want to ask you questions more about the pain in the legs, because someone told me to ask you the difference between, how do you know if the pain in the legs is different with a person that says, at night in bed, I get cramps in my legs. So when we come back, we're going to go into that, because we want people to know the difference. If they have pain in the legs, is that the same as if they have bad cramps in their legs? Mostly, they say, during bedtime. Okay,
Right.
So we'll be right back after this message, again, with one of the masters, Dr. Samuel Putnam with Modern Vascular of Memphis.
GHS-TV started in 1982, and it was just a couple of cameras, a couple of on-air personality, and it's really grown into what you see today. It's a multi-million-dollar studio with top-of-the-line technology.
Being able to operate, all of the machinery in the control room, being able to use all of our software and hardware that we have around the studio is a great skill, because this is top-of-the-line equipment.
I feel like this class has brightened my horizon. It's something that I never thought I would be doing, especially as a student.
GHS-TV is probably one of the most hands-on experiences a student will ever get in their lifetime.
Welcome back to Crosstalk. Nothing really has just the vibe that we have here.
Especially after you finish, you get a real rush of, wow, I just did that.
By the time a student graduates from Germantown High School, they will know pretty much every position there is, from producing to directing to on-air work.
You learn time management, you learn organization, you learn how to work with people, how to better communicate with people.
We put a lot on them, and they have to be able to have the responsibility and the knowledge to get everything that we ask them.
I had very little experience, so in the past 3 years, the skills that I've learned have absolutely exponentially grown.
The class has actually helped me figure out that I want to go to college for journalism.
When a student graduates, they are the best possible version of themselves that they can be.
Thanks for tuning in. We'll see you tomorrow.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. I'm your host, Betty Lamar. Joining me is Dr. Samuel Putnam, interventional radiologist. Okay, now, Dr. Putnam, we're back. And we left off with wanting to know what is the difference between a person that say they have severe leg cramps, especially like at bedtime, but no other time, versus what you mentioned about with PAD, you know, having leg pain. Can you unpack that for me?
Well, it can be hard to tell. I mean, there's many reasons to have leg pain, and at night, I know a lot of people just get leg cramps and go on various medications to take care of those. That may be a manifestation of peripheral arterial disease. That type of pain is very common in diabetics, especially foot type pain and cramping, along with the neuropathy that they can get with decreased sensation and numbness and tingling. So it can be difficult to distinguish all those, but doing a physical exam and an ultrasound study to look at the arteries and going by the whole history and just getting, you know, a thorough history of how the pain manifests. Is it only at rest? Is it only at night? Does it happen during the day too when you do things? How is it relieved? When you get up and walk around with the foot cramping at night, does it get a little better? That could actually be significant with the diabetics, especially because that means you can get better blood flow down to the feet when you're up walking. So we see many patients that have those symptoms. Not all of them have peripheral artery disease, but they can. So it really takes a thorough history, physical examination, and usually an ultrasound or some other imaging study to show if they have vascular disease or not.
Okay, so speaking of diabetes, you know, we all know that for some reason, I guess diabetes is almost like a full body disease, right? It affects so
Absolutely.
much. So what does diabetes have to do with PAD?
Well, it leads to plaque buildup in the arteries more than normal people get. So the high sugar just causes inflammation. It's more of a very small vessel disease. So they might have, you know, fine, larger vessels, more central in the body, but only have manifestations in there's distal peripheral arteries, like in the foot. So they get foot symptoms more commonly than other general population or other people who get vascular disease. And there's not a lot of ways to treat that small vessel disease. Of course, you have to control the diabetes, which is number one, and not smoke. But there are smaller vessels that we can get to in the foot. It's called the pedal loop. Actually, there's a picture here behind me of an arterial treating the pedal loop, where there's very poor flow on the left image, and then we can restore flow on that image to get better flow to those, 1-2 millimeter vessels that go down to the foot. We can't treat the micro vessels that go to the toes, but we can treat the smaller vessels to get up to that point. So that's one thing we do differently than most people, is really get into those vessels, mostly in diabetics who get that type of disease, and really get better flow down to their foot, and again, ultimately avoid the ulcers and the gangrene and the amputations that nobody wants. Yes. Obviously.
Okay, well, I'm gonna back up just a little bit. Most doctors mention somehow smoking related to almost everything that goes horribly wrong with our bodies. So, what does smoking have to do with your vascular health?
Well, again, it accelerates atherosclerosis or plaque buildup in the body. It also causes spasm. Nicotine itself causes narrowing of the arteries. And anytime you get narrowing of the arteries, you get slow flow. And when you get slow flow, you get less blood flow. And actually, they're harder for us to treat if they're smoking because we see that happen during the procedures. We can get in there with our small catheters and guide wires, and we see in heavy smokers, very often they just go into severe spasm, and it's hard to treat those vessels. And we know that's happening when we're not touching them. That's just something that smokers get. So in many ways, it's just a really bad thing to do, especially if you're prone to vascular disease for other reasons, either like high blood pressure or diabetes, obviously. Then smoking just accelerates the process. It doubles, triples your chance of having vascular disease.
Okay, so smoking is just not a good thing for the human body.
In every way. Bad for your lungs, bad for your blood vessels. And again, this same disease process, we're mainly talking about the feet, but it's the same process that causes heart attacks and strokes. So, there are things people can do. I know smoking is really hard to stop doing, but everybody should be encouraged to do that, and it will help you live a longer, happier, less, disease-ridden life if you're not smoking.
Okay, well, thank you so much for discussing that because, like I said, it's so rare. Then we're talking about the kidneys, diabetes, or heart. Smoking always come into play somehow. So we can't talk about that really enough. So now let me ask you this. Is your job hopefully to prevent a person from having a heart attack? Are you opening up the blood vessels or clearing them out? Like I look at it like plumbing, you get that plumbing open. So explain how what you do affects, maybe prevent, if you will, heart disease or heart attacks.
Right. Well, I'm not treating the heart. I don't go into the heart. But peripherally, the similar process, when people have heavy symptoms of either bad claudication, which is pain when walking, they get to the point where it's only getting worse. We might try preventive stuff first, as in a walking program, because that always helps. The more activity can help prevent progression of the disease as long as modifying the other risk factors. But when it gets to the point where we have to treat to avoid the bad symptoms happening, the ulcers, the amputations, then we essentially open up the arteries. We have various ways to do that. We go in them directly, obviously, through a small puncture hole. And we have devices called atherectomy devices where we can shave the inside of the artery or treat it with a laser that essentially obliterates the plaque. We have angioplasty balloons, same as in the heart, to dilate the vessel. We have stents that we can use to, open them up and prop them up, keep them up. And then,
that's okay. This is really good. I'm gonna jump in that. We're gonna take another break because that's exactly where we was going, into all the devices and treatment options that you have. And then we wanna talk about some female, I guess you would say, medical conditions that you all treat at Morton Vascular of Memphis. We'll be right back with more Medical Talk.
And it's very fun to be in band, trust me. It's so much fun.
When I was an 8th grader and I saw them march, and I was like, wow, I need to be a part of this.
Our main performing group is the varsity band. That encompasses our marching band and our varsity concert band. We also have the jazz ensemble.
It's unique, so we're really lucky to have that.
I'm very methodical about teaching. I try to stay up to date because I want my students to have the best information that I can pass along to them.
He's excellent. He commands a sort of drive that we didn't exactly have.
I lead the class, but I also believe in the students self-assessing their work.
The leadership is led by the students. We lead most of the practices. It's basically just student-led.
And I think that's important for them to take that kind of ownership.
If you want to be a musician, you gain extremely important music skills, music techniques.
1, 2, 3.
There's so many opportunities for fellowship, and band is a family. And you develop that small community where you support each other, not only musically, but in many ways.
Really, without the band, the football games would be lame. Without the band, you wouldn't really have the pep rallies. The band is like a good foundation for the school spirit. If you want to join band, just do it.
I think band was the best part of my high school career.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Thanks for tuning in. This is Medical Talk. I'm your host, Betty Lamar. The show today is all about your vascular health and wellness. And joining me is one of the masters, Dr. Samuel Putnam III. Okay, Dr. Putnam. Now, I'm having a good time. And you were just speaking about and explaining to us all the medical devices that you all use to get people healthy that's living with PAD and other vascular, I guess you would say, conditions. So let's jump back there. I want to go back over that again, and I'm going to sit back and learn something.
So it's been really amazing for me to see over the past 20 years or so, just the boom in technology with imaging and all the devices we can use to open up these arteries. When I started 20 years ago, we were essentially just doing arteriograms and looking at blood vessels and maybe doing a balloon angioplasty here and there. But most patients who had these conditions had to go for surgical bypass, which is a bigger operation. Durability for at least getting down to the smaller vessels was not good. And over time, with all the companies working together and a lot of scientists and all the doctors who have been really progressing this technology have just developed all great techniques as well as great equipment that we can use. The X-ray equipment is much better. We can see much smaller vessels now than we could before. Even the pre-procedure imaging with MRIs and CT scans and ultrasounds has really progressed what we can do. And then the equipment that we use in the room to open up these arteries with the atherectomy devices, like I discussed briefly, which essentially can shave and remove the plaque that's in the arteries, or using lasers can essentially obliterate the plaque. And then special balloons and smaller technology, almost human hair size guide wires we can use to get down into these smaller vessels. And then, the stent technology has increased dramatically too. There's now drugs that are put on stents that can promote just durability and make it last longer as far as the stents not shutting down like we used to see in the past. There's still a ways to go to get more and more better technology for these much smaller, more distal, down in the foot type vessels, and we're headed that way. There's a lot of science, there's a lot of research going on, and we're basically on the front edge of that. We're cutting edge, we stay attuned, we try the new things that are out there. So I think if you come to us, we'll have the best and the brightest working on it.
Wonderful. Now, I'm really going to learn something. Let's talk about the medical treatments for women's health. What does Modern Vascular, what do you say? What do you do there in treatment for women's issues?
The big thing for women's health that we do, and with peripheral artery disease, we want to open up blood vessels, but as an interventional radiologist, there's also been a lot of times I want to close blood vessels. And a big problem for women, especially in Memphis, it's very prominent among the African American community, are uterine fibroids, which are benign tumors. They grow in the uterus. They can be highly symptomatic as far as heavy menstrual bleeding or pain, bulk-related symptoms with pressure and urinary bladder frequency and back pain and leg pain, especially during periods. So what we've been doing for the last really about 25 years now, it's very well proven, highly successful procedure is uterine fibroid embolization, which can prevent or at least delay a hysterectomy, hopefully prevent, and it can be useful in women of childbearing age who have these heavy symptoms but can't use their uterus, obviously, they want to have kids, but also for a premenopausal woman who just need to get through a few more years before they're going to stop menstruating anyway, and the fibroids will not be growing anymore. So it's a procedure we can do in the office, outpatient procedure. We essentially go into the uterine arteries and inject small beads, which slow down the blood supply. They specifically slow it down to the fibroids, stop the bleeding, decrease the size of the fibroids over 3 to 4 months, and then continuing over time, and dramatically reduce the symptoms, can prevent hysterectomy. It's 90 to 95% effective for these symptoms. And again, it's a well-proven procedure that's been out 20, 25 years.
Okay, well, as always, I listen to learn, so I jump back a little bit. As with diabetes, certain diseases or whatever is always associated with certain behaviors or race of people, right? So when you mention the fibroids and women of color, do you all know scientifically why it affects women of color more?
I don't. I think it's a genetic predisposition for whatever reason. But as far as why it's more prominent in African Americans, I honestly don't know.
Okay.
Now, there may be some disparities in treatment, more of a socioeconomic thing, but as far as why it's there in the first place, I don't know.
Okay, well, what is pelvic congestion syndrome?
So that's the condition where the veins are essentially dilated in the pelvis, and it causes chronic pain, and they get this reflux. So usually the veins should bring blood back to the heart. In pelvic congestion, they're not doing that effectively. The veins are dilated, and blood just pools in the pelvis, get congested, and causes pressure and pain. And what we do is essentially go into those veins and block them off.
Okay.
Kind of similar to the fibroid, we plug up vessels to reduce that congestion in the pelvis. It takes a lot of diagnostic tests to prove that that's the actual problem, but once we do that, there is a valuable treatment for it that we can provide.
Okay, Dr. Putnam, this was I always say, an awesome show. And yes, you are one of the masters, okay? So if you will, share your website or anything that people need to know, because they're signaling us that we've done a great job, but we have to go off the air.
So our website is modernvascular.com. That'll then direct you to whichever site you need to go to closer to home. We have the one in Memphis that just opened. We also have one in South Haven, just south. So either of those. And then that'll also tie in with other resources and patient information. And then if you go on interventional radiology sites, just Google PAD, and also American College of Cardiology and Vascular Surgery Society. There's plenty of information out there on treatments, prevention, and education.
Okay, well, thank you, Dr. Samuel Putnam III, for joining us today to give us the information that we need to make healthier lifestyle choices. Thank you for watching Medical Talk with Betty Lamar on GHS-TV. Remember, you can also watch Medical Talk on Fridays at 9:30 p.m. on Comcast Channel 17. For more information on our programming, please check us out on the web at ghstv.org, where we're streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Betty Lamar. From all of us at GHS-TV, thank you for watching Medical Talk, and I hope to see you again.